Social workers in the Western Cape are under attack. The Social Development Department in the province says the professionals are being attacked more frequently in townships like Khayelitsha, Nyanga and Gugulethu. Emergency medical services are also facing an increase in attacks and hijackings when responding to calls. At the same time, the department says it will employ over 200 social workers. Let's discuss this more with Western Cape Social Development MEC, Sharna Fernandez. Thank you so much for your time, MEC. Very worrying to know that those wanting to move into the community and better the lives of those that are in desperate need of help and assistance are being attacked. Maybe just tell us how dire the situation is.
Good afternoon, Heidi, to you and the listeners, and thank you for the opportunity. It is a concerning phenomenon, and as you might know, there are hotspots in every province, what we call red zones. But the attacks on our social workers are becoming more frequent. And it is not only physical attacks on social workers, but we've also picked up that there is an increase in hijacking of government vehicles, which talks to syndication. In the last 3 months, we've had 3 hijackings in the Khayelitsha area, and we have also had vehicles stolen. So it is part of it is crime that is prevalent in those areas, whether it's hotspot, Nyanga, Khayelitsha. But what is more concerning for me are the attacks on our social workers. So I'll give you an example where 2 of our social workers had to go into an area, and sadly, SAPS refused to accompany them because they considered the area too dangerous. And once our social workers were being assaulted, their car was rocked and there was physical threat to their lives, then SAPS came to assist them to get them out of the area. Now this does not only affect social development and social workers, it affects all emergency service workers, whether it's health, whether it's fire services. So we rely heavily on SAPS, and thankfully in the city of Cape Town, we have metro law enforcement who would accompany our social workers. But one also needs to understand that most of our cohort of social workers are predominantly female. And so the working day finishes at 4, and then they work in a buddy system from 4 until 10 p.m. So if there is a call out in those hours, they would normally have to go to a police station with a government vehicle and be escorted by SAPS to the affected area. Unfortunately, if SAPS does not have a van available, our staff cannot go in. And so we experiencing the knock-on effect. But what worries me is when you have to go and remove a neglected child from an environment that is not good for this child, the social workers also run the risk of being assaulted by the very community that is meant to protect the child. So it does seem as if this, what we thought was a once-off activity, is now emerging, and there's a clear trend of syndication in terms of hijacking and theft of government garage vehicles, and also a concerted attack on our officers in these hotspot areas. I will give you an example. In Atlantis, we had 8 laptops stolen, and yet we have inner perimeter, outer perimeter, we have safety gates, we have burglar bars. The perpetrators, unfortunately, entered through the roof. So it is an attack not only on social workers, but an attack on our communities. And this is the traumatic impact of this on a team cannot be underestimated. And it is deeply worrying to me and the senior management team. And at a cabinet level, we have raised the safety of our staff because there are more than 80,000 employees in the Western Cape government. And if we can't keep our staff safe, how can we keep our communities safe? So it is unfortunately a much bigger picture than just a simple attack on 1 or 2 social workers.
It's very, very worrying, considering that the social workers are moving into these areas and communities where there is a desperate need. I hear you speaking about, for example, police not wanting to move into certain areas. And I know, for example, even eNCA teams have been attacked and robbed in certain townships in the Western Cape. And now only can you move into those areas with police escorts. I'm wondering what your engagement is, MEC, with the police in the province, because clearly you need more support when these social workers move into these areas. Are you getting that support? Are you getting an indication that SAPS understand the severity of this?
Heidi, I think in fairness, we enjoy a very good relationship with SAPS in the province. With General Patakili, he is actively involved in everything that we do as a government. You might know that we have deployed what we call LEAP officers who work very closely with SAPS. So the relationship in the province is a very good one. In my visits and oversight visits to police stations, resourcing is a big challenge. And you might pick this up when you do an interview with the Minister of Policing Oversight, Minister Regan Allen, is that the province is hugely under-resourced in terms of members in blue. And this is the big challenge. The other factor that must be considered is that in this province, we are still operating on the census figures of 2001. Yet you might be well aware that post-COVID, we saw the emergence of many informal settlements that now also need to be serviced, not only by social development, there are health implications, education implications, and many people choose to come to the Western Cape to retire. So let's say last year, there were 126,000 individuals who came to settle in the Western Cape. Yet the number of nurses, doctors, teachers, social workers have not increased. And funding is another constraint. But I say kudos to our men and women in blue in the province. Where they can, they go out of their way to assist us, but their biggest challenge is with human resources, with the tools of trade that they need. Vans, you would know how many vans are standing in the yard with smashed windscreens, no tires. So that clearly is a SAPS issue which must be dealt with nationally, but we enjoy a very good relationship in the province. And with most police stations would go out of their way in terms of the referral pathway between the various entities. It is a national issue. I think that is not, it's been flagged, but it is not taken seriously enough. And something is going to give, because we are seeing policemen and women taking their lives, and they are experiencing trauma as a result of being overworked and with the pressure that is placed on them. So you could almost put the police in the same cohort of workers who are under pressure, because if it's dangerous for them to go in, let alone dangerous for us, I mean, where does that leave us as a society?
Yeah, MEC, just very briefly and lastly, are you able to tell us what the way is forward? Because you obviously need your workers and social workers to move in. You've just mentioned how the police are also at risk. Emergency services are also at risk and fear for their lives. How do we fix this? How do you allow for a safe environment for social workers to move in? And it obviously has a lot to do with informing the communities that, you know, you need people to come in and help you and allow them to do their jobs.
Heidi, thank you. In the Western Cape, we have a recovery plan, and one aspect of our recovery plan is that it's a safety plan, because we are focusing on violence prevention. So when we work in hotspots, we work transversely as a government. So it would be education, health, social development would all go into a red zone area. But you're right, our biggest need is to ensure that communities understand that when government services or any services by NGOs, NPOs need to be delivered in an area, we need the community firstly to protect the social worker, the firefighter, the nurse, the community development worker, and then more importantly, we need communities to understand that the buildings in their areas are assets that belong to the community. And if they damage, destroy community assets, they are actually limiting themselves from receiving services. So we are constantly driving awareness and education regarding the safety of not only person, but property as well. The sad thing is that there are many active citizens in our province, but there is a criminal element that manipulates a system, and when they see an opportunity, they become opportunistic, and unfortunately then everyone gets branded and labeled. But I have had to, in one occasion, say the safety of the staff is paramount. We cannot go into a specific area unless we know we will be accompanied by SAPs, by the Metro law enforcement officers, and that the community stakeholders, because remember, in these communities, there are community leaders and activists who have the ability to inform the community of the needs and priorities. So it requires what I would describe as a whole of society approach to ensure the safety of all workers, not just social workers.
Well, we wish you all the best, MEC. It is definitely a worrying picture there. That is Sharna Fernandez, who's the Western Cape Social Development MEC.